Namaskaram, sir.
Namaskaram.
Please tell me about how you came to the field of Ayurveda and your family history in Ayurveda.
Actually, I belong to a traditional Ayurvedic family with 7 generation. I mean, according to my knowledge, last 7 generation was practicing Ayurvedic Netrachikitsa and plastic surgery and also Panchakarma Chikitsa. And after that, I came to here in Ayurvedic field after entrance exam. When Kerala state government started first entrance exam, then I was selected into that one. Then I came to Ayurveda as a practitioner. Now my son, he is doing his PG, and daughter-in-law, she is also doing PG. My daughter is in Kottakkal Ayurveda College, and we are a settled family in Ayurveda.
Sir, and what is different about your approach to Ayurveda? What is unique about your approach?
Approach means actually when I started 33 years back, this hospital, that time in Kerala, even though Kerala was the seat of or saddle of Ayurveda, the Panchakarma therapy and also the other practical aspects of Ayurveda was not in so much practice, because people were keen to take medicines only, that means OP practice. But we people started hospitals. When I started my hospital, it was the 9th hospital in Kerala. Now there are more than 2,500 hospitals and clinics and Panchakarma centers. Now people are widely using Ayurvedic Panchakarma therapy and also Ayurvedic fracture management, then Marmacikitsa, then pediatrics, and all complete Ayurveda is very active nowadays in Kerala.
And how did you come to Marmachikitsa, sir?
Marmacikitsa means it was when I came out of Kottakkal Ayurveda College, that time Marmacikitsa was a dead science in practical, because theory we take from the colleges, we studies it, but practical approach was very bad. Nobody was not practicing. So I personally traveled all over Kerala and also Tamil Nadu, Karnataka, and Telugu, in North India, and contacted the various gurus, and I took the ideas, I studied all the ideas from them. Then gradually I started practice. So along with this, Kalari martial arts practice was very popular in Kerala and still also. So it is practical application of Marma. It is defending method, but at the same time, other aspect of Kalari is that it is treatment also. But there is no academic course for Kalari martial arts practice. So I traveled all over India to get an idea about the treatment and the Kalari martial arts practice. And foot massage or massage with the leg foot is one of the important treatment procedure followed by the Acharyas in management of different types of marma bigada, dislocation and also back pain, then sudden injuries and everything managed by foot massage. So after getting the idea about the foot massage, different types of management, then different types of fracture management, and so many other methods in Marmacikitsa. Now I am practicing it, and at the same time, after practicing this, along with I started taking classes to Ayurvedic doctors all over India and abroad, based on Tamil Marma and Ayurvedic Marma.
Sir, and I think now Marma is becoming more popular, but why is it important for Ayurvedic doctors to learn Marma and to study?
No, actually Marmacikitsa means it is the casualty or emergency management of Ayurveda. Actually, it's developed. The Kalari Marmachikitsa is which developed from Dhanurveda, mentioned on the Puranas or in the classical text. So, this Kalari Marmachikitsa is highly effective and sudden in action, and you can give a very fast result to the patients. And also the management of the fracture. I mean, different types of fracture we can easily manage with Ayurvedic or Tamil Marmachikitsa. So that was the importance. And again, for example, you get a patient, accident patient from bus accident or road accident, you can easily treat the patients with Marmachikitsa methods. Different techniques are there. All these techniques you can use, and also variety of medicines are there. Raw materials available for this one are easily to get. So that was the reason. Now, when I started taking classes or practice of Marmachikitsa, people, the Ayurvedic community was not interested to come to Ayurvedic Marmachikitsa. But nowadays, at least all over India, suppose you consider at least 1 or 2 seminars on Ayurvedic Marmachikitsa is going on. In our department, Marma doctors are appointed. CCRS also, Central Research Institute, they also started Marmachikitsa clinic in their centers. So all these things are the development. I am proud of that by my effort, and Dr. Sreevaths and also Dr. Suresh Triveni Hospital in Trivandrum, and also Dr. Saifuddin, few doctors. Basically, it's the origin is from me. I think it's a happy thing.
And sir, about medicine production, please tell about your experience and what Ayurvedic doctors now should be focused.
Okay. Earlier, up to 25-30 years back, each and every doctor or Vaidya was preparing medicine for their patients. Nowadays, the company system came. That means pharmacies. So, doctors are getting quality medicine from different companies. But the problem is that one, if you want a rare medicine combination, yoga, it's not easy to get. And the procedure or the preparation of the medicine is also another problem. Because if you are practicing the production, then only you will get the idea how to prepare the medicine. Nowadays, the problem is that one, doctors don't know how to prepare the medicine. That means the techniques. The production technique is different. It's because it is like the production of the, preparation of the food in the hotel. So quality preparation, it became only to the secret knows to the companies only. So that is the limitation. But preparation, if the doctors can prepare their medicine, then it is more good according to me, because then they can understand what are the raw materials, what is the preparation, production techniques, how can we improve the quality, how can we boil the drugs, and what should be the size of the raw materials, everything that you will understand. This will upgrade the production quality. So the product of the production and the product or the medicine's quality you can control by yourself. Otherwise, the standardization and the controlling is by the pharmacies or the companies. Their standard is something different from our idea. That's the limitation. And they make, almost all the companies prepare or manufacturing medicine which gives more profit only. They are not focusing on the treatment effects. Profits only they are. In our factory we prepare all the medicines, but if suppose one doctor asks, they ask for preparation of some medicine special, that also we can provide. That is the difference. That's the difference between other companies and our companies. And our company is a GMP certified company, national and international certification, and with our modern facilities and everything is there.
And sir, for my own curiosity, why is Chauti Uzhichil indicated in Marma Abhigata? What connection is there?
Okay. Now, actually we use hand massage, that is called Abhyanga. And the difference between the Padagada or foot massage and hand massage is, it is more forceful and powerful. Because comparing to hand massage, Abhyanga, the pressure applied on the body of the patient is 8 times more than this hand massage with the foot massage. So more pressure you can apply. Second thing, if the patient is very stout or bulky or physically tough, in those patients hand massage is not so effective. Just they feel only very feather touch effect. But foot massage, why we are using foot massage as part of a treatment means the stretching, especially the muscle stretching, joint stretching, and also the tendon stretching. On a tough body, you cannot give much pressure and you will not get the result. But if you give stretching this foot massage, then the result will be very fast. That means comparing to hand massage, if you do it for 2-3 weeks, this you, by 5 days or 6 days you will get the result. That's a difference. And the poses are also different comparing to hand massage. In hand massage, generally 7 poses we are following, but here more than 20-25 poses are there. In this, you can select which pose is more apt and suitable for the patient. That you can select. That's the difference between hand massage and foot massage.
And finally, sir, is there anything you want to share with future Vaidyas, next generation, how it is they should be thinking, what is important for them in their practice, and how we can improve Ayurveda for the future?
Actually, when you study a subject, then only you will understand what is subject. Usually academy means just getting in touch with Ayurveda only. You will get an overall idea. But after the practice only you will get the idea about the... But earlier the system was different. When you practice this, what happens means, from childhood only, from 7 years onwards, the boy or girl get in touch with medicine preparation and consultation, sitting with his father or guru, then unknowingly he is getting thorough knowledge about the and theory he studies later only. But before studying the theory, he gets full practical knowledge. For example, my son, he usually came here and took training in Panchakarma therapy, and every vacation he was staying here for 2 months from 7th standard on, from 7th standard. So what happened, he was thorough with Abhyanga Uzhichil and Chauti Uzhichil, even Vasti applications and preparation of the medicines and Patra Botla preparations and the Nyavara Potali preparations. So before going to BAMS college, Ayurveda college, he was thorough with the practical knowledge. So that I am telling, earlier that was a system. They get an idea about all these things, and along with the theory is getting later, and then the theory and practical things become concrete like slabs. So it is strong. So that is the advantage of previous system, I mean traditional system. Now after plus 2, that means after 18 years old only the students are getting idea of the BAMS syllabus, and practical system they are getting only for 3 years maximum. So the practical application or practical practice getting very little. That's not good. And after that they are releasing to the public community, and so there will be a struggle or a puzzle how they will get the idea about the treatment. That's the difference. So my advice is always get thorough knowledge about the subject and also practical knowledge. And you want to get confidence, no fear in management of patients. Then only you will become a thorough, efficient Vaidya. And nowadays, again, another problem in Ayurvedic fraternity, the doctors are not ready to do Abhyanga or Patra Paula Sveda. Any body touching treatments they are not ready to do. Doctors are telling that it is the duty of the therapist to perform all these things. That is not correct, because doctors want to get an idea about the Abhyanga, Patra Paula Sveda, massage, different types of massages, foot massage, Basti, Prayogas, and every treatment they want to get. Otherwise, how can they evaluate the quality of the therapist? Because they want to get an idea. Otherwise, whatever the therapist tells, they want to believe it. So my advice always, definitely the doctors want to practice Panchakarma therapy, Purva karmas, and everything, even medicine preparation. And if you prepare a medicine or you are following in the factory that from the raw material to the packing, the preparation, and that product you are giving to your patient, so you will be very confident. That's a different, and there will be a touch of your soul with the product and the patient. Otherwise, you are purchasing from the market and you don't know, there is no soul touch. That's the difference between the self-production and the practice. And whenever you touch the patient, then you will feel more, the patient also feel more confidence, and also you also will understand what is the surface anatomy, what is the structure of the body of the patient, and how it is acting, and everything with practical knowledge only. So compartmentalization, it's good. If you are busy, you can put a therapist, but at the same time, at least 1 or 2 days, the first day of starting of the treatment, you start with the treatment in the patient. It will give more result and confidence to the patient.
And
Okay.
sir, last thing, you mentioned before when one of your seminars that you wanted to be a movie director before you came to this study. When can we expect Ayurveda movie or Marma movie?
Yes, that movie is already the script is over.
Ah.
It's based on the life of Ayurveda Acharya Susruta.
Ah.
It is how Ayurveda Acharya Susruta developed Ayurvedic surgery systems and also the surgical procedures, plus the equipments and everything. Mostly by end of the May, the preliminary works will go, because it's a huge investment. One producer from here, Kerala, is very good producer, and they liked the subject, and mostly it will be a pan-Indian and pan-global movie. Mostly all of the famous directors and technicians and artists from various areas of India and abroad will join in this project. And we are planning to release the movie in 2026. And the work is going on. Last week also there was a discussion with the producer and their technical groups.
Excellent, sir. Thank you so much. We are looking forward to seeing it.
Thank you.
Namaskaram.